AFA at the Core podcast are available at afr.net. Back to AFA at the Core on American Family Radio.
Welcome back to the Core here on American Family Radio. Glad to have you with us today on the program. I'm your host, Walker Wildmon. If you want to watch the show, you can go to streaming.afa.net. Streaming.afa.net. Go ahead and create an account there if you don't have one. If you do, great. Go ahead and log in. You can watch the show live. You'll see the show featured right there on the homepage. We are live streaming on Facebook too, or as well. You can watch it on Facebook by going to AFA at the Core show page. I do want to introduce our next guest. We do have with us Brian Blase. He's president of Paragon Health Institute. Brian, welcome to AFA at the Core.
Thanks so much for having me on.
Absolutely. Well, Brian, tell us a little bit about yourself and the entity you preside over, Paragon Health Institute, and then we'll jump into some of the topics on the Affordable Care Act.
Sure, thanks. So I launched a new health policy think tank, Paragon Health Institute, a little less than a year ago, and I've spent the better part of 12 years working on health policy. I worked in the House of Representatives, the U.S. Senate, and then the first 2.5 years of the Trump administration, I served at the National Economic Council in the White House.
Brian, the Affordable Care Act, it's a jumbled mess, and you know that firsthand, probably dealing with this, as far as the original law that was passed, and then the bureaucrats came in and started rewriting the law, which is actually illegal, and that was a whole lawsuit. But what is the status of the Affordable Care Act?
So the Affordable Care Act, if you think about it, it's got three main aspects. It's got significant regulation. It put a whole bunch of requirements on health insurance that were sort of unprecedented coming from Washington. Had major new spending programs. The biggest one was a huge expansion of the Medicaid program. And then there was a variety of taxes and spending reductions in Medicare to pay for all of the new spending. In terms of like the status now, the Medicaid expansion is really the biggest part of Obamacare. There were sort of the goal of Obamacare was to create a very robust individual market for health insurance. This is where people go that don't get coverage through their employer, that have upper middle income. And that has largely failed. The regulations pushed up the price of insurance, pushed up the deductibles. Networks are very narrow, meaning that plans don't cover a lot of hospitals and doctors. So those plans haven't been very attractive. But the Medicaid expansion has proven pretty robust. About 38 states have expanded their Medicaid program. It's really a welfare program. So really Obamacare at its heart has just been a huge expansion of the welfare state, putting a lot of lower income families into the Medicaid program. As far as the spending side, it's this year the spending in Obamacare is projected to total more than $200 billion. There were significant increases in subsidies that were enacted in the Biden stimulus, the American Rescue Plan Act that he signed at the beginning of his administration. And so there has been some increase in the individual market size, but that's mostly because of government subsidies. On average, the taxpayers are paying about 85% of the premium for someone who's enrolled in the exchanges. The Trump administration made some progress rolling back problematic aspects of Obamacare. So the individual mandate penalty, that was the fine on people that didn't purchase Washington-approved insurance, that was zeroed out. And the Trump administration opened up some options outside of Obamacare that were more affordable for people. But most of the main infrastructure remains in place. I will say one more thing. Many of the taxes have been repealed. So at the time, President Obama said he wouldn't sign legislation that would raise federal deficits. I mean, that is another broken promise with Obamacare. The new spending is not paid for, and Obamacare is significantly increasing federal deficits.
Well, Brian, let me ask you this. It sounds like the Affordable Care Act or Obamacare is very much alive, very much still around. Should government really be meddling around in private health insurance? I mean, this is really about health insurance more than health care, because there's a difference between the two. I mean, what role constitutionally does the federal government have meddling around in health insurance? I mean, where can I find this in the Constitution? Please let me know, Brian.
Well, I think you make a really good point. Health insurance is different than health care, and health care is different than health. What we really want is a healthier American population. And even before the pandemic, life expectancy in the U.S. was lower in 2019 than it was in 2013. So we had a huge expansion of government health insurance, lots of new rules, spending, taxes, and Americans got less healthy. So not only is there's constitutional concerns, and I agree with you there, there's also significant policy concerns where their programs don't work. And, in healthcare, we don't have a free market in healthcare. And that's one of the things that I really try to point out, because a lot of the problems in our health sector are driven by government, by bad regulations, by a bureaucracy that thinks that it can manage the health sector, and by a set of subsidies that really result in enormous amounts of waste and misspending.
Many people will remember this, but the iconic thumbs down from John McCain, the late senator from Arizona, the Republicans for years ran on repeal and replace. Remember, that was the campaign slogan, even though some argued, do we really need to replace this thing with another bad bill? But nonetheless, that was the overarching promise from all the Republicans, including the late Senator John McCain, that we will repeal Obamacare and we will replace it. But when it came to the vote, Brian, it didn't pass. It didn't pass. So what's the holdup amongst what was the holdup amongst Republicans with fixing or getting rid of the ACA or the Obamacare?
So Obamacare's core provisions took effect in 2014, and you had many states, including some with Republican governors, expand their Medicaid programs. And you also had people really make a lot of hay out of, if you repealed Obamacare, you would hurt people with pre-existing conditions, and they could go back to being denied coverage. I think there were policy solutions to those problems, and that you could have constructed a much freer market health insurance system that also protected people who had expensive medical conditions. But it was just very difficult for Republicans to navigate the narrow margins that they had in 2017 to come up with a repeal and replace. And really, it was improperly named. I certainly thought that large parts of the law should be repealed, but it was more sort of a modification of Obamacare, and the party just wasn't unified. There were some. I mean, this is a very long. I could talk to you about this for days. I mean, I lived this in 2017, but there were also just some problems with the process. The Congressional Budget Office produced very biased scores of what repealing the individual mandate was going to do. They attributed sort of this mythical power to the individual mandate, compelling people to buy coverage who otherwise wouldn't, and it just wasn't going to be. It caused the estimates of Republican replacements to show that a lot more people would lose coverage than would actually happen.
Fascinating. Well, Brian,
but we were all disappointed, I think, when John McCain issued that thumbs down, and it really stopped the process. The Trump administration did what we could.
Yeah.
So we were really focused on expanding options for individuals and for small businesses that were harmed by the law. But there's a lot that Congress still needs to do to address structural inefficiencies with Obamacare.
Yeah, no, the Trump administration, I mean, kudos to the Trump administration, and I know you worked there for a time. The administration they fought tooth and nail. They did everything that they could to help the American people. And a lot of the stuff they did, even regulatory-wise and through the rulemaking and the bureaucracy, ended up providing some relief to Americans. Well, Brian, thanks so much for coming on TheCore, bringing some insight to the healthcare issues of our day, the health insurance, rather, issues of the day. I appreciate you coming on TheCore.